In her elder years, Wanda Irving hadn't planned on raising a child. That changed when her daughter Shalon Irving died after giving birth to now 5-year-old Soleil.
Shalon was wonderful. She was the kind of daughter that every mother dreams of having. One of her maternity pictures.
Wanda says Shalon wanted a daughter more than anything, and that the pregnancy went smoothly. She ate well, exercised, and kept up with her doctor's visits, but after giving birth, her limbs swelled, her blood pressure spiked. Does Wanda think Shalon communicated well with her doctors?
She was a certified health education specialist. She had been a professor. She wasn't heard. She wasn't respected. She wasn't believed. None of that.
The Irving family story is far too common, Wanda would learn after launching a nonprofit devoted to the Black maternal health care crisis. Maternal health is an issue U.S. Vice President Kamala Harris has made a priority.
The United States of America has one of the highest maternal mortality rates of any so-called developed country.
Rohini Kosoglu is the Vice President's domestic policy advisor.
Black women, they're 3 times as likely to die during pregnancy as white women. For Native American women, it's twice as likely to die.
The Vice President has spearheaded efforts to address what pregnant and postpartum women need. The list is long: nutrition, transportation, housing.
Lactation support, access to mental health services, doulas that can help advocate for women in these different hospital settings. We also looked at strengthening the workforce. So there are shortages around the country of OBGYNs and midwives.
Behind these efforts is U.S. Representative Laurel Underwood, co-chair of the Black Maternal Health Caucus, one of the largest bipartisan caucuses in Congress.
In this country, we know that there is systemic racism in institutions, including in our healthcare system. Oh, you have a higher pain tolerance. You're more likely to be addicted, so we're not going to offer you all of the treatment options available.
Pepper Reed has 5 children. When she had private health insurance, she says the births went well. But after she lost that, she says she didn't receive as much pain medication as before. She describes having her 4th child.
It was one of the worst experiences of my life. I actually threw up. I could feel all of the pain. I was crying, yelling, screaming. It was horrible because a lot of the doctors and or the medical staff really do not believe when a mother is telling them that they're in pain.
Again, Congresswoman Underwood.
So usually there would be things called protective factors, meaning higher income, higher education level, you're employed, you have health insurance, you got your prenatal care. For Black people in this country, none of those things are protective.
Change can't come soon enough for Wanda Irving. She remembers the last time she and her daughter spoke.
She says, "Mom, I don't know what's going on, but is it going to be okay?" I said, "Yeah, baby, it's going to be fine. We're going to get through this. It's going to be all right." And to this day, I have the guilt telling my daughter it was going to be okay when it wasn't.
Laurel, Bowman, VOA News, Washington.